I now would like to invite Ms. Graziella Zimmerman, Public Relations Officer of the St. Maarten Cancer Foundation, to give her address.
Good morning, Honorable Prime Minister, Mrs. Sarah Westcott-Williams, Honorable Minister of Public Health, Social Development and Labor, Mr. Cornelius de Wever, President of the Healthy Caribbean Coalition, organizers, conference delegates, ladies and gentlemen. On behalf of the St. Maarten Cancer Foundation, I would like to say that this is both an honor and a pleasure to be able to speak today. Cancer is a disease that affects everyone, both directly and indirectly, and the more awareness and support we can bring to it, the better our understanding and our abilities to combat this disease. I'm just going to shed some light on the three aims of this conference. Number one, building cervical cancer advocacy among Caribbean cancer NGOs. Cervical cancer is the second leading cause of death in the Caribbean. You may ask yourselves, with all this information available to us, whether it be through doctors or the internet or just general knowledge, why is this disease still the second leading cause of death in the Caribbean? Well, even though that question has several answers and several factors related to it, I think one of the main factors is patient advocacy. A patient advocate acts as a liaison between patients and healthcare providers to help improve or maintain a high quality of health. That being said, the best experience is personal experience. A rule that needs to be implemented as soon as possible is the use of a patient advocate. Patients going through cervical cancer or cancer in general may not know their next step or which medicine does what or what their new diet should be. A patient advocate can answer these questions to make the patient more knowledgeable with the situation, offer support to the patient as well as their loved ones, thus creating a chain effect so that the patient can feel more comfortable in this condition. Number two, building M-Health and E-Health capacity among Caribbean cancer NGOs. M-Health is a term used for the practice of medical and public health through the use of mobile, and E-Health is a term used for healthcare practice supported by electronic processes and communication. Nowadays, everyone has a smartphone, and these smartphones, well, according to some people, save us time. However, we have these genius inventions in our hands that, if used properly, are tiny vessels of vast knowledge. We can use these to our advantage in terms of health. Our technology is so advanced that we can download an app, type in our symptoms, and we get the results in less than 5 seconds, as well as which medicines we should take. That in itself is extraordinary. However, in terms of Caribbean cancer NGOs, we can design an application that can be downloaded on all types of smartphones to be used specifically for the Caribbean. This app should be tailored to fit Caribbean needs, for example, our diet, our environment, and our mental and social health. This app can give a patient or an NGO or a medical doctor access to chat forums to discuss about health issues. This app can offer support to a patient undergoing cervical cancer, diabetes, or heart disease. This app can list all of the available doctors as well as their contact information so the patient can feel a sense of closeness to their doctor. Same goes for e-health. Weekly or even daily newsletters can be sent out as soon as someone signs up for the app, so that we can ensure that all the information we have at our disposal is being sent out. Number three, development of a Caribbean Cancer Network. When I think of the Caribbean, I think of family. No matter where I go, I have this feeling that if I have any trouble, somebody will be kind enough to help me out. And that is exactly who we are. The Caribbean is a huge family, and when one person is going through something, for some reason we all feel connected. As I stated in the beginning of this speech, cancer is a disease that affects everyone. Not one person can say they haven't had a situation with cancer. Whether it be family, friends, strangers, newspaper articles, we all have had to deal with this disease in one way, shape, or another. That being said, if anything is necessary after this conference, it will be the development of a Caribbean Cancer Network. To me, this means a place to go where information can be shared, resources can be used, doctors and patients can communicate in a comfortable way, medicine can be distributed, healthy diets can be practiced, and support groups can be available. But most of all, and I think most important, a place where someone can go and they know they are not alone. I once bid you a warm welcome. I once again bid you a warm welcome, especially to those who are visiting from abroad, and wish all the conference delegates a fruitful deliberation. Thank you.